The onset of monsoon season allows for the breeding of female mosquitoes spreading dengue. With the cases rising, experts predict that there will be more cases noted in the next 4 to 6 weeks. K Durga Prasad, DNB and Medical Director Ankura Hospital, explains the need to protect children from dengue. Dengue fever is like any other viral fever. The factors that can differentiate dengue from other viral fever is a sudden onset of high fever of about 103 to 105 degrees Fahrenheit, associated with severe headache, pain behind the eyes, severe joint and muscle pain, exhaustion and rash over the body. All these symptoms can also be associated with nausea or vomiting. The symptoms can last for over 5 to 7 days. These symptoms can be seen in normal viral fever also, but in dengue, exhaustion and joint pain are very severe and children look sick even when there is no fever. Any child who has features such as severe pain in the abdomen, persistent vomiting, not passing enough urine, feeling very weak, or excessive sleepiness with fever or 1 to 2 days even after the fever subsides are the children who should be taken to doctor immediately. Most patients with dengue fever can be treated at home. They should take rest, drink plenty of fluids and maintain a nutritious diet. Taking plenty of fluids is very important and prevents the complications of dengue fever. Fever should be treated with fever medicines. Antibiotics are not required. If the home remedies are not working or the child is very sick, then the child is admitted to the hospital. The treatment is hydration with the administration of intravenous fluids, having control over vomiting and monitoring the blood parameters to look for thickness of blood and liver enzymes, etc. Platelet count usually decreases during illness, but treatment and assessment of the severity of the disease are based on the degree of dehydration and thickness of blood. Platelet count has no role in either of them. Increased risk of bleeding in dengue is associated with decreased blood supply to the vital organs and low blood pressure. If the above is normal and the child is clinically improving and has good oral intake with no sign of dehydration, then in most cases, a low platelet count should not cause a problem. But if the child has low blood pressure and severe dehydration, then chances of bleeding are present even with a relatively higher platelet count. In such cases, we need to monitor the disease very closely. At present, there are no vaccines to prevent dengue fever. Dengue is caused by the bite of the Aedes mosquito. This mosquito bites during the day and the highest biting intensity is about 2 hours after sunrise and before sunset. To prevent mosquito bites, wearing full-sleeved clothes and long dresses, especially when going outside, and preventing water from accumulating and mosquito breeding are important factors. Preventing mosquito bites, giving good fluid intake during fever, and keeping an eye on the danger signs can help us prevent the disease and the complications associated with the disease in children.